Designing for Health Equality. It's going to be an interactive session. I'm not going to be talking at you for 45 minutes. You might have spotted some orange envelopes under the seats. Do not open them. We will use them later, but I don't want you to get a head start. It can be very competitive, so you're going to be working in teams on a few rounds and activities. Is everything okay? Good, okay. So it's going to be an interactive session giving you a quick taster of how a design mindset and some design tools can support you to think about how you might want to address health inequalities in a way that's person-centered but whole system. So I'm Joanna Choukeir. I'm design director at UsCreate. We're a design agency. We've been around for about 12 years and we specialize in health and well-being. So we use design and we put people at the center of that process to improve health services, experiences, ways of working, and ultimately health outcomes. So some of you might have heard of BBC Radio 4's The Fix around end of summer last year. Has anyone listened to any of the Fix episodes? Can you put your hands up if you have? Great, okay, a few of you. Brilliant. So we facilitated these episodes. My colleague Kat Drew actually hosted them. So this was a very interesting approach that the BBC was taking around solutions reporting, so looking at how news portals and media can be involved in actually reporting solutions as opposed to just the problems that our society face. So the episodes broadcasted how a design approach can help with that. So taking that to popular on popular radio. So each episode brought together experts, scientists, artists, service users, service providers to think about how they can come together to address some of society's most intractable challenges, things like childhood obesity, alcohol, housing, and reducing reoffending. So that was a very exciting thing for us to be part of. So design is at the core of what we do. Some of you might be familiar with the term design thinking. Can you put your hands up if you've heard about design thinking? Okay, a few of you in the room. So design is very much a mindset. It's an approach to addressing social challenges, so using a number of tools and mechanisms that put people at the center of the process, but ultimately lead to innovative and quite different and radical approaches to solving old and inherent problems in our society. The Design Council published a few years ago a report evaluating the value of design. They identified that for every £1 invested in design, organisations can generate £29 in business returns, which I guess was really exciting for us because we could finally put a bit of a figure on a process that can be quite intangible. As I mentioned, the process that we take is person-centered, so we put people and their needs and their lifestyles and contexts at the heart of the problem. We try and understand from their points of view why they make particular decisions, why they lead their lives in particular ways. And when I talk about people, that's patients, that's residents, communities, citizens, and that's also workforce. But equally, we bring the whole system together to look at the needs of these individuals and how we can support them. So we promote collaboration across the social determinants of health, and it was really refreshing to see the plenary session in the morning and to see some commissioners really talk about how important that is. So we invite organizations, we invite service providers, so across sectors to work together from health, housing, education, employment, looking at the built environment to think together about how they can work together to support individuals. We've had the privilege to work with organizations who really understood the value of taking a social determinants approach to improving health. That it's quite a brave approach, particularly because some of these organizations we've worked with, probably five years ago, when some of that stuff was probably not sort of not the new norm, I suppose, at that point. So what I'm going to do is take you through a bit of a walkabout of some of the exciting projects that we've worked on with some of these organizations. So we worked on improving health across the social determinants with Hastings and Rother CCG. This was a 3-year program, really starting with communities and some of the root causes of some of the health inequalities issues. They were really interested in looking at how a behavioral science approach can improve health inequalities in the most deprived communities. So we conducted scoping work, so looking at obviously existing evidence, looking at data, but more importantly, really listening to the concerns and understanding the contexts of local residents and the services around them. And that program was across all life stages and across all health issues. So it was a very different approach to commissioning, where usually a health commissioner would say, actually, we want to tackle this specific issue. It was a very open approach. And that process of working closely with local communities and providers and using some of that evidence and data informed a number of different programs that had some significant impact. So to share some of these through the process, that was for some of the providers, for some of the partners, that was the first opportunity for them to work together in that way. So they created a commitment to collaborate together across the system in the longer term. And some of the specific programs and service improvements led to more tangible impact. So for example, a 15% increase in stop smoking registrations amongst smoking pregnant women through just shifting referral pathways into midwifery. Skipped one. Improving health through housing. So this was a piece of work with Nesta and Optivo Housing as part of the Open Data Challenge series a couple of years ago. We were interested in looking at how we can support residents to access more suitable housing quickly to improve their health and well-being. We know that social housing registers and waiting lists are very long. It could take up to 8 years to be matched to be matched into appropriate housing. We also know that often you can only look within the local housing stock, the social housing stock. You can't really look beyond that. So we worked with Optivo to build MoveMaker, which is an app that allows social housing tenants to swap homes if they want to downsize or upsize, or if they want to access a property or housing that is more suitable for their accessibility needs or the proximity of things they need around them. So there's lots of potential. I mean, it's still early days, and I think Optivo are really trying to get appetite and interest from housing associations and local authorities around MoveMaker, and it has been quite a challenge. But the potential for this idea is huge. It's significant. They can potentially help about 500,000 households over-occupying their homes, and about 400,000 households under-occupying. Improving health through education. This is a project with the Royal Society of Public Health, who are interested in improving resilience and well-being amongst children, particularly children transitioning from primary to secondary school, so year sixes, because we know that's often the beginning of mental health issues occurring and then continuing into becoming sort of chronic and long-term conditions. So we collaborated with young people in schools. They co-designed a Truth, Dare, Share game. You can tell from the name that it's quite targeted for that, and they came up with the name for that audience. It's basically a game that's embedded within PSHE classes. So children come together in teams and they play the game for about 15 minutes in each lesson, and then they continue the game at the next lesson the next week. So you play the game throughout the full academic year to get to the end and to win by the end of it. And the exciting potential for that is that it's been embedded within the RSPH's youth health program, so all participating schools can embed the game within their curriculum. Improving health through social networks. So a project with the Healthy London Partnership was looking at how we can support families to leverage their social networks to be able to make the healthy choice the easy choice. So again, working very closely with communities, providers, social entrepreneurs, and local assets. We generated and supported 3 social enterprises to emerge that were run by the local communities. And some of the impacts, so for example, for Make It, which is a healthy and affordable recipe pack that families can pick up at the school gates or at housing housing estates. The evaluation demonstrated that 73% of participating families reported eating less ready meals, and 83% felt more confident cooking healthy meals. And the last example, oh no, there's two more. So you can see I'm going through the social determinants, you can get the gist. So improving health through employment, a project with Policy Lab in the Cabinet Office and the Department of Health and Department for Work and Pensions, looking at how we can support people with long-term conditions to stay in or return to work, because that's a shared agenda for both of these governmental departments. So they came together and worked with with service users, with GPs, people who work within job centres, to design a well and work service, which brings together the health system and the jobs system. And the impact, because this was a showcase project, it supported the case for a 40 million innovation fund to promote more collaborative working between the two departments, and the Joint Work and Health Unit was formed as a result. And then finally, improving health through the environment. So this project with Guy's and St. Thomas's charity focused on actually understanding the impact of some of the environmental factors, so urban, diverse and deprived communities on health. So we spent a lot of time doing ethnographic research with people across the life stages and understanding their lifestyles, their challenges. And that insight was shared in a highly I suppose, illustrative report that now Guy's and St. Thomas's charity use as a point of reference for their strategic decision-making, their investment decisions, and their program priorities. You can see the report. It's called Personal Perspectives on Life on their website, and you can also watch some of the videos of some of the local residents who were involved in the research. So I guess there are four key principles that bring a lot of that work together and that underpin the work that we do. One is deep human understanding, so really ensuring that we're taking the time to understand what makes people tick, what is driving some of their decisions and how they're leading their lives. And to bring that to life, so in the Well and Work project, one of the women who was involved in the ethnographic research had shared that she'd been struggling with depression and anxiety for a number of years, but had never spoken to her employer about it. And then at one point she was diagnosed with cancer, which is very traumatic. But she said that she was actually relieved because she could finally go to her employer with a physical symptom to ask for some time off. So I think these really deep insights can really help us understand why there are particular issues that we're not able to grapple with year on year, and we sort of introduce lots of different initiatives, but we just feel like we're just walking, we're not making any progress. Reframing challenges, so this is about ensuring that we are addressing the root causes of an issue and not its symptoms. So continuing to ask ourselves why. Some of you might have seen the systems map, the life systems mapping activity that we have in the open space, where we're trying to sort of ask as many layers of why as possible to really get to the roots where we can actually start to affect change. So to give you an example around that, we were commissioned to redesign a chlamydia testing service to increase uptake. And when we started doing some user research with young people, we realized that actually there's nothing wrong with the website. Young people are not even getting to the website. They don't know what chlamydia is. One participant thought it was the name of a flower. And those that do know what chlamydia is don't want to order a self-test kit at home because their parents opened their post and they don't want them to know that they're sexually active. And those that do decide to take the test think it's really weird to put your pee in the post. So there are a number of behavioral issues. So the root cause, the problem was not the website. It wasn't the transactional bits of the service. It was very much around thinking about behavior change and normalizing sexual health screening. Collaboration. So I guess a lot of the work that I've just talked through talks about promoting and enhancing collaborations across the system. We can see that happening more and more, accountable care systems, STPs, and I think it's really exciting, the Work and Health Unit. So I think it's really exciting to think about what we can do together, how we can think about our shared challenges, or think about our challenges as shared challenges, think about shared budgets, because at the end of the day, we're all trying to achieve the same things. And then finally, prototyping and testing. A lot of the solutions or ideas that we end up with haven't really been tried before, or we would be working in a space where there isn't very much best practice or evidence practice. So we often have to mock things up and test them out quite quickly, but within low-risk settings, so that we can build confidence in the direction of travel, and so that we're able to justify further investment. And we do kill a lot of ideas. I'm not saying that through this process you are guaranteed something that's going to work. It is very much through prototyping and testing that you can decide whether you want to carry on or stop. Right, so what we're going to do now, it's going to be over to you. You're going to do a lot of the hard work for the rest of the session. So we're going to invite you to engage in 2 rounds of activities to help you get a bit of a taster of the 4 principles that I've just shared. So I'm going to ask you to get together in teams of 4. Maybe start counting from that side of the room. So you'll be 1 team, and so on. So say hello to each other in your teams, and I'll let you know what we're doing next. Everyone stop. We're going to do some sharing. We're going to be kicked out, I think, in about 6 minutes precisely. So thank you so much for all your input into the 2 activities. Can I invite any teams to share an idea that they came up with that I think is worth sharing? And maybe a reflection from the team around something that you're taking away from the last 20 minutes. Got an enthusiastic team over there. Yeah, so do you want to go at the back?
So we went down the theme of sort of social network and how much that will then help them to build self-esteem and to then get self-efficacy. But something that I've been reflecting on with this is how does this fit? So we've probably all got a very much a health and social mindset and kind of built environment, etc. What about the fact that design for advertisers and IT, Apple, etc., they have moved design to being how do you feel when you interact with their product or their service, and therefore it's much more about tapping into our feelings through something than necessarily what's in our face. And so actually, I think challenge for us in terms of the health and social sphere is how do we also not jump on that bandwagon, but appreciate that that's the trend and the movement of design.
Brilliant, yeah. That's a really interesting sort of way of framing how you might approach solution development or generating ideas around that. Any reflections from the process, from the last 2 rounds?
It was challenging, being £1 billion, what would you do with it? I mean, that's, you start to think the big scale, would I build something new to do the housing side of it? And actually
Any teams had to do it within £1? Which one do you want? Do you want the £1 billion? I think you do. Great. That team over there, do you want to share the idea that you came up with and any reflections from the process?
Okay, so we talked about a get-you-in pack. I was in the forces, and when I used to go to a different country, you used to get like a little get-you-in pack, and it would talk to you about, tell you about culture, what was available around you, a little bit about sort of the local people, a little bit of history, and also give you information about the schools, the different things that you need in life, hospital, doctor, etc. And I mean, I guess thinking to what the previous group was saying, it doesn't have to be a pack, physical pack. It could be an app where you just download that, and importantly in a language that you can understand. So it's no good just saying because you moved to Wales you have to have it in Welsh. It might be, we've got a really good Polish contingent, and therefore it would be far more helpful for Jacob if it was in Polish rather than in Welsh, because he wouldn't get it. And we also talked about making sure that the local resources and community were involved in that, and offers for our Jacob, as we had on here, to be able to invite himself to different groups. So as part of that pack, there may be an email that you fly off, or there may be an invitation to introduce yourself, and you send it through the post or whatever it is. And the other thing we talked about was if we needed to do something in a day, we thought the obvious choice would be a community event, and using residents' associations and celebrating the diversity of cultures around the locality, bring a dish, sharing, and also sort of understanding the social cohesion of the people around you.
Yeah.
So did we miss anything there?
I think it's a very timely idea and intervention within the context of regeneration, gentrification, and sort of old and new neighbourhoods. And I know that Barking and Dagenham Council are very interested in sort of a similar approach, so thinking about, the concept of a welcome pack, but how do you get new people moving into a neighbourhood up and running quite quickly? Brilliant. Any other ideas? Anyone else wants to share? Yes.
We also acknowledge that social isolation was a big problem for Jacob. But as we worked through it, we thought that possibly budging or calling a person rather than providing him with a group, because he certainly seemed to prefer less group-oriented activities. Yeah. Albeit, but recognising that what we do now is we provide groups.
Yeah. It doesn't work for everyone.
Surely they're terrifying themselves.
Yeah. And I've just made the assumption that you are all that you all enjoy group working by giving you the two activities. So apologies for those who do not enjoy that type of work. But yeah, exactly. I think there isn't a one size fits all, and I think we need to recognise that individuality.
Yeah, the other thing we talked about a bit was about finding him a job. So I think it's easy to say he's 51, he's come out of employment because of a health reason, but actually if you read the detail, he didn't want to stop working.
No.
He wanted to change his working pattern, so it's finding an employer that can recognise the limitations of his health condition, but actually support him to continue employment. And poverty in the over 50s who are unemployed is huge. So actually as a society that would have benefits about keeping him active, and that financial income might then help his family into another world, which would be exciting.
Absolutely, yeah, absolutely. I think we need to think about new types of jobs to support more people to be able to work with long-term conditions, because we know.
Give a job in the library. He likes books and he likes quiet.
So Great. So just take a couple more points. Yes.
One of our groups suggested it would be great if Jacob could be introduced to Kim.
Absolutely, they're neighbours. They should just meet.
The second thing was we noticed that Jacob was very much off the radar of most services, voluntary or public sector, that would help him. Absolutely. The one point of contact he had was with primary care because of his physical illness. Yeah. And it just brings home, doesn't it, that there's an opportunity there for primary care and other health professionals
to connect,
to think broader, and be the navigator of the whole health and social care system.
Yeah, absolutely. At the back.
My reflection would be just that we need to be careful about assuming what that person wants, and actually, if we really are making this person centred, do we need to sort of speak to them, thinking about what
Absolutely.
Is there? Is it important to get a job? Is it important to be socially connected? Rather than this is what would work for you. You need to, learn how to do this, you need to do this, or whatever. I think it's really important to sort of look at that person. I know that's difficult to do on a scale, but equally trying to move away from that top-down approach of this is what works.
Yeah, absolutely. And I think a lot of the challenges that we have is try to sort of make sure that the voices of these individuals are heard, and that their ideas are sort of we're inviting them to contribute to these. So we host a lot of sort of co-design spaces and workshops and sessions, but we also do some co-design with people in their own homes and environments, and it's really interesting because you do need to spend some time leveling the playing field, because if you sort of bring commissioners, providers and people and service users or patients or people into the same room, sometimes they're not comfortable being in these environments. Generally, they might not like to work in groups, and so the more dominant voices in the room get heard, but their voice is still not heard. So really thinking about how we can do this at scale and how we can support more people to actually speak out about what they would need and what would work for them. Great, I'll take one more. So I'll take one more comment from your team, and then we can wrap up.
It was just a couple of quick reflections. One was about, we said about Kim, that her background as a nurse and meant that even though that both Kim and Jacob had long-term conditions, she was kind of primed to access healthcare, so she knew how to tell her GP what she needed. Yeah. And whereas, yes, he has a GP who's probably struggling to manage GPs probably struggling to manage their entire caseload, and may be referring him to Jacob to other services, but Jacob may not choose to go to them, or may not know how to ask for additional help from his GP. Whereas Kim knows knows how to go in and say, I need this, 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 and this, and my husband needs this, 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 and this.
Yeah.
So that was one reflection. And the other being that Jacob sounds a lot like my husband, who's quite looking forward to retirement because he then won't have to talk to anyone else.
That sounds like my husband.
Or having to talk to anyone doesn't necessarily mean that he is socially isolated or lonely.
True.
It's just he's really looking forward to not having to talk to anyone for the rest of the week, or choosing to go and talk to someone. And we have to be mindful of that. That there is a huge problem with social isolation in this country, and I'm not putting that down. But he does live with his family. He's not completely isolated, but he may be choosing to not speak to people.
Yeah,
and we're
sometimes that's a
mindful of
choice.
that.
Yeah, sometimes that is a
I just have to
consequence.
make one slight challenge to those 2 points though, which is this is partly about equity, isn't it?
Absolutely.
Yeah.
He's going to die 20 years before Kim, on the face of it, and so giving somebody information about the kind of things that they may do to change their circumstances is to me something we have to do. We have to give people that information.
Yeah.
So that I must say as well that actually people are listened to, so that when you make your voice heard, there is a result as an effect of that.
Yeah.
Because if we keep asking and then we don't do anything or we don't change our systems, then
Yeah. And I think the employer comment is very relevant to that. It probably took Jacob quite a lot of courage to go up and ask his employer to shift his working hours, and then to not have that. Yeah, exactly. Great. Well, thank you everyone for all your input and your energy. So if you've enjoyed this session, we'd love to work with you, to collaborate. These are some of the things that we can help you with. If there's something not on the list, we're always up for a challenge. And do visit our open space and the systems map. Help us contribute to that. We're going to share a digital version of the health and equality systems map with all delegates. So if you're interested in, we'll share it with everyone. So you'll hopefully get a copy. Great. Thank you.